Good morning. Good morning and welcome. My name is Madeline. I work at the Los Angeles Public Library in the Office of Civics and Community Services. Welcome to today's program, Doula Who, Doula How, Doula What, the Transformative Power of Community Doulas. April 11th is the International Day of Maternal Health and Rights and the first day of Black Maternal Health Week. Black Maternal Health Week is a week-long campaign founded and led by the Black Mamas Matter Alliance to build awareness, activism, and community building to amplify the voices, perspectives, and lived experiences of Black mamas and birthing people. Today's program is brought to you by LAPL and Frontline Doulas. Frontline Doulas has brought together a panel of 5 doulas: Kefri Riley, Michelle Sanders, Felicia Francis Edwards, Nakomi Kirby, and Deanna Carpenter, who will be discussing the who, the how, and the what of doula care. After the panel discussion, we'll have a brief Q&A, so please send your questions throughout the program, and we can answer them at the end. All right, and now we will get started in bringing in our panel. Okay, and I will start with introductions. So I'm here with Deanna Carpenter. Deanna Carpenter is a healing artist, creator of She Who Builds, a platform and community that supports women in confidentiality in confidently architecting and building a holistic life of their imagination, and Frontline Doulas program manager. She is on a mission to inspire healing, which she describes as a remembrance of and returning to one's truest self. Deanna is the author of 2 books, Lessons from the Fall and In My Solitude. In 2018, she released her first album, Tsunami. Deanna is a certified Kundalini yoga teacher and birth doula, and she is currently working on her second musical offering, Come Inside. Welcome, Deanna.
Thank you.
And next up, we have Felicia. Felicia Francis Edwards has worked in the Los Angeles area for more than 30 years and has served in several capacities, including case manager, social work assistant, health education assistant, and clinic manager. She completed her doula training with Doulas of North America, known as DONA, and immediately began taking on clients. Felicia works with 2 agencies that provide doula support for Black birthing people in Los Angeles: Frontline Doulas and the Los Angeles Public Health AAIMM, which stands for African American Infant and Maternal Mortality Pilot. Each of these agencies provide free doula services to all Black birthing people. As a doula, Felicia has attended over 150 births. She feels it is a sacred honor to serve pregnant people. She sees working as a doula a calling that allows her to support the families she serves. To educate, encourage, and affirm is at the heart of her practice. She's grateful because she gets to do what she loves. Welcome.
Thank you.
Okay, and next we have Michelle. Michelle Sanders is a full-spectrum doula, lactation educator, certified surgical technologist, and the founder of Beauty for Ashes Maternal Wellness, Inc., a nonprofit that offers programming for birthing people at the highest risk for poor birth outcomes. Michelle has been providing support to birthing families throughout Los Angeles for over 20 years. She uses her vast knowledge and lived experiences to connect with parents to help them and their babies find their way. From 2019 to 2021, Michelle served as the program coordinator for the Los Angeles County Department of Public Health AAIMM doula program, where she helped to design and implement a free county-wide doula program for Black African American birthing people. Presently, you will find her on the front lines advocating for Black moms and babies, or behind the scenes working to help birthing families get the support they deserve. She also provides mentorship to newer doulas. Michelle's strong belief is that it takes a village to raise a child, and is the basis on which Beauty for Ashes Maternal Wellness Inc.'s service model of multi-generational support was founded. Welcome. Next, we have Nakomi Kirby. Is a DONA certified birth doula, postpartum doula, prenatal massage specialist, and supports mothers with lactation and breastfeeding. She provides significant support to women and families during prenatal, birth, and postpartum stages. Nakomi offers doula and massage services devoted to the concerns of every individual's needs. She's very nurturing to women and dedicated to maternal mental health. Nakomi pays special attention to the signs of postpartum blues or depression during the prenatal and or postpartum period to give gentle suggestions for care that encourages quality mental health for the well-being of mother, partner, and baby. In addition to her private practice, she's committed to serving the Black community and was the first leading doula of Frontline Doulas during its inception in 2020 at the height of COVID-19, accommodating families virtually. Within her community, she took the initiative to do a diaper drive collective by raising money for all Frontline Doula families and other Black families in need, serving over 50 families in total. Welcome. And last but not least, we have Kefri Riley. And Kefri is a women's mysteries mentor who comes from a lineage of birth keepers, preserving the art of the intuitive wise woman through everyday divine experiences. Her foray into the world of babies has its inspiration from 3 generations of Black birth workers, caregivers, most honorably her paternal great-grandmother, an African indigenous granny midwife from the Deep South. Kefri is a childbirth educator and prenatal yoga specialist and has taught thousands of people to mindfully embody the multifaceted experience of new parenthood. She brings over 19 years' experience as a certified lactation educator, counselor, birth and postpartum doula, doula trainer, newborn carer and childbirth educator, and hypnobabies hypnodoula. Kefri has attended over 300 births, all at all major hospitals in LA County. Her infant classes have been featured in People magazine, on NBC, CNN, and Fox Channel 11 News. She's the co-founder of Frontline Doulas and the CEO of Urban Goddess Lifestyle and Los Angeles Birth Partners. Welcome, Kefri. All right, well, we're all here, and I'm going to disappear and let these women take the stage and continue our panel discussion today. Thank you.
Thank you. Thank you, Madeline, and welcome everyone. Again, my name is Deanna Carpenter, and I am the program manager for Frontline Doulas. Frontline Doulas is a perinatal health program that has connected over 500 plus Black families with Black doulas through our various programs in Los Angeles County and beyond. We are an uplifting generation of community doulas on the front line of birth in the Black community, co-creating and reclaiming family-centered narratives for generations to come. This year's theme for Black Maternal Health Week is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. We are excited about this theme because it directly relates to our mission and the work we do at Frontline Doulas and is a huge inspiration for today's event. Doulas are perinatal care professionals who serve families during birth, pregnancy, and postpartum. Many people are still becoming aware of doula care, the difference that having a doula makes to the overall birthing experience, benefits of a doula or other birth worker, and so much more. We find that having access to a doula or birth worker can help create autonomy and as a reminder that birth can be joyful. There are disparities in the community that are based on fear, and we desire to shift the fear into joy. We dedicate today's panel discussion to April Valentine and Bridget Cromer, 2 beautiful Black women who, during childbirth, expressed pain and discomfort and other concerns and were not fully listened to, and as a result, died. April Valentine during childbirth and Bridget Cromer immediately after birth. Thank you. So we welcome you again to Doula Who, Doula How, Doula What, the transformative power of community doulas. And we're going to go ahead and get started with our first question. So this first question is for Kefri and Michelle. Okay. So we're going to start off. What is a doula? What is a doula? What is a community doula? And what is meant by doula care? And also, as a part of that question, how is a doula different from a midwife? Is there a difference? So, here we go. Kefri?
Deanna, thank you so much for that beautiful introduction and reminding us to center ourselves in joy and in the transformative power that we all hold, especially as doulas, especially with the doulas that are here on this call and the ones that are serving their communities right now. There's a couple different ways to look at what a doula is, but a doula is a caregiver, and she works within the community, within family systems, and within ecosystems of care to deliver amazing support during the perinatal period. So that might be before birth, that might be for your fertility journey. That may be during abortion, stillbirth, or miscarriage, in the perinatal period when you're preparing for birth, during your birthing time, and then in the postpartum period, which is over a year after you've given birth. And so, what we learn about the word doula is that it comes from a Greek word that means servant or slave. And so, I like to really try to decolonize that term. And we do that by using other words such as birth worker or birth keeper. So, we're coming out of that hierarchy or that caste system of servant or servitude, and kind of repositioning the powerful work that community doulas do as birth workers or birth keepers, as healers, as really preservers of cultural inheritance of this beautiful birth work that we do. We really are kind of like a new zeitgeist, if you will, of returning to this beautiful community care, such as our grandmother midwives did in the past. And these were African and indigenous midwives, and indeed from every tradition that gave community care to all babies in the community, even when they were enslaved. So they were brought here from Africa, or they may be here as indigenous people. And they were the ones that were responsible for birthing America, I like to say. And at some point, they started to become sterilized and taken out of community care systems as hospitals became the primary place where we gave birth, right? But when we returned birth into the hospitals, that means that they were mainly white, heterosexual male OBGYNs that were taking the babies, right? So it was very different than when the grandmothers were catching the babies, were healing the mothers, and tending to the community at large. And so while doulas are not midwives, because midwives are the medical care person. They're licensed and certified medical care professionals that are there to take care of the family during their birthing time and also before they have the baby and after. Doulas are there as emotional support, educational support, um, psychosocial support, advocacy support, physical support. Okay, so there's a big difference between a midwife who's giving the medical care and the doula who's taking care of all other aspects of the family system and preparing you for birth. And they're really aligned with what the family needs and brings the birth experience centered back into the family, into their autonomy, into their joy, into their personal choices so that they can have their rights observed at birth. And right now, we have such an extreme disparity in Black and Indigenous birthing communities, both for infants and in our maternal death rates, that we really need to bring back the voices of those who are birthing and what it is they truly need and desire. Because once you listen to the birthing person, you listen to the family and what they need, they typically know exactly what they want and what they're wanting to achieve. And so if we can collaborate with healthcare systems as opposed to kind of relying on those systems to tell us what to do, and so a doula helps you claim that power back and recenter that power to the family.
Thank you, Kefri. Michelle?
Yeah, so just to kind of piggyback on what Kefri was saying about like the traditional part of the doula work that we do. And so when you talk about community doulas specifically, a lot of times we are serving the community that we are from, right? So like I'm born and raised in South LA. Most of my clients are in South LA or the surrounding areas. They look like me, and we are serving people, not only in the capacity of a traditional doula but as a community doula who has connections in the community, who can help you navigate resources, because these are some of our same lived experiences, right? That now we're able to support this family in a way where we become part of their families a lot of times. um, Community doula work to me, excuse me, um, I really just like to explain it by saying like this work, community doula work, is rooted in um, birth equity, right? It's rooted in reproductive justice. And, in addition to the pregnancy, we're also addressing other social determinants of health, which, we don't know what may be going on in this family. However, if you have other things going on, if you have financial barriers to support, community doulas are more accessible, because a lot of times, there's a program that's paying for the doula support, or just individually as community doulas, we offer pro bono support, sliding scale. We try to work with the families to make sure that they actually have the support that they deserve and what they desire. And so,
community doulas, we are, in the trenches, like boots on the ground. It's not just the pregnancy. It's not just this woman or this birthing person. It's the whole family dynamic. And a lot of times we stay connected to those families. A lot of us have had experiences where we have provided doula support to a family, and then later that birthing person decides that they want to now become a doula because of the support that they received. And so, it's just building up on, like, this workforce of community doulas and offering that community level of care. And, all doulas are great. All doulas are amazing. So whether it's a traditional doula or a community doula, if you desire to have a doula, I just really would hope that people understand that finances are not a barrier. Where to find a doula. Of course, people go to Google, right, to find any and everything. And it is absolutely a good place to start. But when you're looking for community doulas, community based organizations, faith based organizations, just the folks in your community is a good place to start to find community doulas to provide support to you.
Wonderful. Thank you, Michelle. Thank you so much. And also, this next question is for you as well. So, Michelle, can you share with us some background about the current disparities in Black maternal health and how we are creating healthy, joyful outcomes with doula care?
Okay, so the disparities, we mentioned at the opening of this broadcast, Black women are dying, and Black women are dying at a much higher rate than any other race, right? So Black women are 3 to 4 times more likely to die during childbirth or immediately after. And we know that things happen and sometimes people pass away. However, what we're talking about are preventable deaths, right? And so this is a result of systemic racism. This is a result of Black women being ignored, as you mentioned, Deanna, about Bridget and about April Valentine. And so, Black women's pain is ignored. After a Black woman has a baby, they may not receive the best care. And so sometimes we have postpartum deaths that occur. Black babies are more likely to die before their first birthday. And again, this is because of racism. And so, we talk about these statistics all the time. And, it's important that people understand that, but it's also important that people understand that we are here to help, that having a doula as a part of your birth team greatly reduces the risk of mortality and morbidity. Having doula support really just can change the trajectory of your family, right? And so we want people to understand that although these statistics, we want you to focus on being proactive and doing what you can to make sure that you have the support that you need so that you can have that joyous birth that you deserve, so that your postpartum period can be beautiful, because it should be. And with the right support, it can be. And so that's why we do the work that we do.
Oh, thank you so much. As I was listening to both you and Kefri, I caught a visual of the griot and just thinking about how, in many ways, the doulas and birth workers are kind of like the griots of birth, making sure that, information is in the community and that these families and birth persons and mothers are well equipped and have the information. They're the ones who's passing on the traditions and the education and the resources. So that was something that came to mind, and listening to you both speak was like, oh, this griot, like looking at, birth workers as the griots of birth. So thank you so much. Thank you both. Moving on to our next question. Frontline Doulas has been having some success with its outcomes. Kefri, can you tell us more about the Frontline Doula program and its framework?
First of all, I really want to acknowledge for a moment that you brought up the word griot and the oral tradition and the passing on of medicines, which is what doulas or birth workers and birth keepers do. And these medicines aren't just something that you administer with a pill or through a serum or through an IV. These are medicines that include all types of cultural inheritances, such as dance and prayer and collective gatherings and storytelling and remembrances and movement, right? And touch and song. And so this heritage was passed on to me through my father, who was his grandmother's midwife's assistant. And during that time, which was, gosh, in the 1920s in Greenville, South Carolina, he would cut the wood for the birth so that there would be hot boiling water, and he would lay out the newspaper so there would be a sterile field. And he would go with his grandmother late at night and hold the oil lanterns at the time, because there wasn't necessarily electricity everywhere at that time, and make sure that the care was provided to the community, and witness the love and the ministry of humanity that the midwives held. And it's that we're keeping that sacred flame alight, if you will, right, through community doula work, and also the resurgence in Black midwifery, which is so key. Midwifery care is really, really key, especially supporting our Black midwives in delivering better birth outcomes. In our program, we've been very fortunate to be funded by HealthNet and Blue Shield of California and other, and LA Care and the community, and donations from the community. And our outcomes have been really incredible. And these beautiful doulas that are on the call today, Sisters Nakomi and Felicia, are here as some of our lead doulas, and Michelle also is one of our founding doulas of the Frontline Doulas program. But we have really incredible outcomes, such as 0% preterm births. And we've got a 14% preterm birth rate in African-American communities. So that's a 100% drop in preterm births, which is pretty incredible, as well as compared to the 14% low birth weight, we have 7% only in low birth rate in our programs. And we have a 43% reduction in cesareans from the 37% national rate to about 21% in our programs. And so you're immediately getting better health outcomes with doula care, which is evidence-based, because you're lowering the interventions, right? You're giving culturally congruent care. Our families are being heard. So the advocacy is in place for them to express their needs, and for the doulas to be kind of like a agent of transformation, right? And to put their voices and their needs first, not the medical industrial system's desires, right? Which are largely led by rules and things that are put in place that are harder to shift and harder to change. And so we like to shift this culture, especially within Los Angeles and California, by making these beautiful doula programs that decolonize birth and become forces of cultural competency and change, just by placing the doulas where they need to be, which is working in their community, working with the families, and engaging with healthcare systems, becoming that bridge between healthcare systems and the families. And or if families want to give birth at home, because that's one of the safest places to give birth as a low-risk woman, so you can do that, or a birthing center. So you have many choices that are available to you. And so our programs include the Centering the Community program, our Black Doula Awards, our Frontline Doula Hotline, which right now callers can go and get a beautiful free call with a telehealth call with a doula, and our various community support programs, mentoring and training. And doula and community doula care, typically you get a lot more care than a traditional doula, because we give 3 prenatal visits, and then attendance at the birth, and 3 postpartum visits, and a large amount of community-centered referrals and practices and advocacy and emotional support. And I believe some of our doulas will talk about some of the really incredible experiences that have been had as we do this. And we can't really just say it's one way, as Sister Michelle was saying earlier, because doulas all work differently. They're typically independent business people. They have their own processes and packages, and they also, and we hope that they would work autonomously and with sovereignty to be able to deliver their services in the community, so that they reflect exactly what we want and desire for our families, which is this beautiful wraparound care and loving care and joyful care, even when things can get really hard. So a doula is there to just really support you and the entire family system, not just the birthing person.
Thank you, Kefri. Thank you so, so much. So Felicia, can you share with us your recent experience with one of your community doula clients that was transformative and poignant for you, and how Black doulas are important for Black families and indeed restore autonomy? And also, please feel free to share anything else you would like to about the transformative power of doula care.
I am so honored just to be able to participate today and be able to share my lived experience working as a doula. I was working with a young woman, and she was homeless. And so she was dealing with the backlash of being homeless and pregnant, and was very concerned about the outcome of her pregnancy. On top of that, she had a lot of medical issues. She had hypertension, she was diabetic, and she was considered elderly prima gravida because she was 42 years old. So she had high risk written everywhere. And so when it came time for her to go into labor, something struck me as I watched the medical staff, the nurses. We were in the middle of shift change, and I watched how they were interacting with her. And I also watched how they were having a complete conversation over her head, talking past her without acknowledging her, not even saying hello or, introducing themselves, but just proceeding to have a conversation. And I had to interject and say, look, you guys need to kind of talk with her, let her know what's going on, and, give her some insight into the process. Now, that's just one experience that I've had. There's been countless times that happens across the country where African American women who are marginalized, or African American women, period, come to places where they're looking to get support and care and help, but are met with biases, are met with, with being ignored, and being left with not being heard. I think that right there is the primary issue that we are all addressing working as doulas, is to be able to help be a voice for those who are unheard, and to help facilitate advocacy to the point where that person now has a voice. So it is transforming. It's amazing to see. I got pictures of the baby yesterday. 9-pound, 15-ounce baby boy, so dang cute. But looking at all the mother had to go through, had she not had advocacy going on around her as much, it could have been a much harder or much more painful outcome. So I think that as a doula, the power that we have to come in and be gatekeepers and to be overseers of people's processes when they are in the most vulnerable places imaginable, having a baby. So that's just my take on how transformative being a doula can be, or having doula services or providing doula services can be.
Wow, that was so beautiful. Thank you, Felicia. And as I was listening to your share, I was just like, thank you for reminding everyone in the space that this is a human, and bringing back forward, our humanity, bringing humanity into the birthing space, right? Because I do feel like sometimes, we think we know what's right, what's best to do. But in that moment, you held the space as this beautiful pillar and reminder, this is a human being, despite what her circumstances and her situation may be. Honor her humanness, honor who she is. And so thank you so much. It just gave me chills listening to you speak on this particular experience. So thank you. So Nakomi, doulas often provide social and emotional support for clients, which seems to have a lot of success in the programs. We know you have a penchant in maternal mental health. Can you share with us the tools you like to use? Is there a particular client that you have worked with as a doula where your support was transformative and integral to them having a joyful birth?
Yes, absolutely. Thank you for having me on this beautiful program for Black Maternal Health Week as well. I'm honored. And what I like to do with my families is like really engaging with them. Like Felicia was saying, and Kefri and Michelle were saying, active listening. That is such an important, aspect that we share as doulas. That a lot of moms feel like they're not being heard. They're not being heard by their doctors. Sometimes they're not being heard by their partners. So as a doula, we step in and establish that connection with them. And once we establish that connection, we're establishing a trust. And then they're able to, really let go and share some of their fears, or not necessarily only fears, but even share their desires. And when you bring in, you know, someone, when you bring something like, oh, I can share like the things that I want, then you're able to, that's how things are transformed, because they're able to say, informed consent, yes, I want this, no, I do not want this. I like to also use the Edinburgh scale, where it's, getting mom's emotions and how they're feeling, just taking a scale on the paper during their prenatal sessions and in their postpartum sessions, so that we can like kind of see where they are, be able to provide some resources for them, whether it's a calming and relaxation resource, whether it's a therapist maybe that might align with them. So just doing an Edinburgh scale is really great. I love to use that. Um, and being able to use, um, the informed consent is like the brain. What's going to be the benefit of, the care that you're receiving? What is the risk that, the doctors are asking? What are your thoughts? What are you going to say? No, do you need more time to think about something? Not always feeling rushed to have to answer someone right away, but to really be heard and hear yourself and go deep within who you are as an individual, and just not being ignored. So I really think that is very transformative, as I can think of a mom who has experienced some deep trauma, with, you know, with males, and she needed to not have any males in the room to be able to give birth freely and not feel, not feel like something was bothering her. So she needed that clear space. So, even though she was asking, I don't want any, males to give me to give me any exams, there were still males being presented. And I had to put a note on the door. Hey, this mom doesn't want to have any males. She only wants female care. So having to advocate for her and continuing to speak up for her when she couldn't necessarily speak up, for herself. She was so grateful. I was so grateful to just be able to, be an advocacy for that mother as well.
This is so powerful, such powerful sharing. I think Kefri can add something there.
I did. I just, as I'm listening to the beautiful stories that Naomi and Felicia are sharing, this is the traditional medicine. This is the griot medicine. This is just that subtle emotional and social support that actually lowers pain. Like when you have somebody in the room that's just there for you, or their gentle touch, or their firm touch, or their calming voice, or the fact that you've already prepared them before so they know that breath really helps to increase oxygen to the uterus and to the baby and to all the muscles, which lowers pain, or reminds you if you wanted to get in the shower or labor in a different position. I mean, doulas are really engaging in a very intimate way with families, and the doulas here have achieved such success in our programs because of these subtle medicines, and as Naomi speaking about informed decision making and informed choice, this is really one of the most powerful tools that we can have, that you need that protective measure, whether that's deep inside of yourself with your partners and it's established with your family. Before you even give birth, you need to be having these conversations with your caregivers. You need to establish if this caregiver is for you. Are they respecting you? Are they honoring you? Are they practicing human rights? Are they dealing with the newest evidence, not outdated practices? And so once you start having these conversations with your doula, with your birth worker, oh, now you're an informed healthcare consumer. The power isn't being taken away. The power is being given and exchanged and ignited. And I think that's why doulas are so transformative, is we're just sitting here tending the fire and continuing to ignite, as Michelle said, this fire of birthing justice, because we really must. I don't think we really have an option right now. As we see over and over again, systems and hospitals, or even right here at LA County, Sentinel Hospital, where these the mothers that transitioned here just recently. This is just recent. This is really happening. One of them was a client of one of our doulas in the Black Doula Awards program. Michelle is doing an incredible walk for them this coming Saturday in honor of these women. I mean, this is really happening. And so we want all families to feel that they have the support that they deserve and that their voices are centered.
Yes, thank you so much, Kepri. Again, just I'm getting all these visuals, the griots, the tenders of the sacred flame of birth. Like doulas are so magical and powerful, and just birth workers in general. It's like what such an honor to be able to hold that sacred fire for these families is truly, truly powerful. We have a few more moments, and I just want to see if anyone wanted to add anything else that either Felicia or Nakomi or even Michelle would like to share about the transformative power of doula care before we move on to our next question.
So one thing I was thinking about, like as Nakomi was speaking and Felicia was speaking, a lot of people still are just really unclear about what we do as doulas. It's just kind of like, oh, it's so elusive. Like I just really don't understand, right? And so, I think about like the saying, knowledge is power, right? And so if you don't have the knowledge about what's happening in your body, what your baby needs, how to even just advocate for yourself, then you are kind of giving up your power, right? But you connect with a doula who now is helping you understand some things about your body, who's helping you even just understand what your rights are in whatever birthing system you choose, right? And so the more knowledge you have, the more power you have. And like Nakomi mentioned about informed consent, a lot of times we go into a healthcare center and we're giving consent. It's not informed, right? They call it informed consent, but if you don't have the information, you're actually consenting to something that you may not understand, that you may not even agree with. And so that is our jobs as doulas. Like, yes, we show up for the birth, right? Yes, we're there in the postpartum, but a lot of the work we do happens prenatally, right? To talk about what things, where are the gaps, right? We're not expecting that you don't know anything about your body because it's your body, right? So you are in control of this body. But if you have questions, if there are gaps, things you don't understand, or you're trying to figure out what your ideal birth looks like, then your doula is there to give you all of the information so then you can make that decision based off of the information, right? And it's not my opinion, it's not Felicia's opinion or Nakomi's or Kefri's. This is evidence-based information to help guide you towards this beautiful birth experience that you're supposed to have. And so we talk about with our clients, like the fear, tension, pain cycle. And so I was thinking about that when Nakomi was speaking, because when you are fearful of something, right? So we're fearful of this birth because we don't have enough information. We're scared about what could happen, or we have these statistics about Black women in the back of our mind. So now we're fearful. So now there's more tension, and then that translates to more pain. So a lot of times with my clients, what we talk about is what is the fear that you're having so we can address it and we can work through it to now get rid of this tension, and hopefully you can have a much less painful birth. I don't like to use the word pain when we're talking about birth. We talk about discomfort and things like that because just the word pain triggers something in your brain, right? And so we tried not to even use certain words with our clients and try to train them to now use these words. So we're not going to call it pain, we're going to call it discomfort. Um, you know, different little things like that. And slowly we're building, and you are sometimes not even noticing how powerful you really are until we just help you put together a few little pieces. And those are the clients who, they walk in and they're super, super scared. And then in the end, it was just like, oh my gosh, like that was beautiful. Like you did an amazing job. And they say, like, oh, I couldn't have done that without you. And it's like, you absolutely could have. But I'm glad that I was able to be here and support you. But you absolutely could have done it without me because that is inside of you. And sometimes you just need your doula to help pull it out.
I would like to piggyback on that. And again, also kind of look at what Nakomi said about informed choice. It is so significant that people have a working understanding of what they're consenting to. And I love one of the things as part of Frontline is we have a little tool that helps the people look at whatever the issue is at hand, or making a decision. And so we go over that, so that gives that person some tools on how to handle when a provider wants to do something that they're maybe unsure about. Being able to say, how's this going to affect me? How's this going to affect my pregnancy? How's it going to affect my baby? So being able to have those kind of questions and that kind of dialogue makes such a big difference. Also, I think the challenge is we tend to, the caste system that we have in the US, we tend to keep the physicians at a hierarchical place where we're just the patient and they're the mighty providers. But it's being able to look at our value and our worth regardless of our race, regardless of our gender. Also, I think that one of the wonderful things that's happening, that's a new thing, is that recently some legislation happened where African-American women will be able to get, who have Medi-Cal, will be able to get doula support via Medi-Cal. And that is such a miraculous development. And I think it's just going to be able to open the door for so many more Black women, African-American women and people to be able to access the services that we are able to offer.
Thank you both, Felicia and Michelle, as well as Kefri and Nakomi. And Felicia, you're really tuned in because we're going to talk a little more about that Medi-Cal doula benefit, a couple of questions in a few more minutes. But I also just want to circle back to Michelle. You said something it really touched me, and it's something I'm very passionate about, is the importance of language. The importance of language, especially in birth, saying pain, but when you say discomfort, it's a total shift. It's like, I can deal with discomfort, but pain, everything goes into, we freeze up, we tense up, we're not relaxed. And so I just really appreciate that you emphasized that and gave us an example. And, again, the importance of language. It's crucial. What words are we using during this experience? So thank you all for everything that was contributed. Right, so fathers and partners can be overlooked when discussing Black maternal health and may not know where they fit when it comes to doula care. How can we involve and uplift Black fathers and partners during pregnancy, birth, and postpartum? So Michelle or Felicia?
So first thing is understanding that as doulas, we're not replacing anyone, right? We're not replacing the father or the partner, or anyone in your support system, right? But when speaking specifically about the father of this child, I'm very intentional about always making sure that they know that I'm not just your wife's doula or your girlfriend's doula, like I'm your family's doula, right? Your questions are different from her questions. And so please feel free to ask me, what those questions are, and we can work through them, because some people don't know that, fathers experience perinatal mood disorders as well. And a lot of times, men, they kind of, tuck their emotions away and they don't want to show that they're struggling, right? But this is a new thing for her and for him, for them collectively. And so they need support collectively. Making sure that this partner knows how to best support her, right? And so we're talking about, like, we actually do like some role play, so, okay, labor happens. What are we going to do? What are you going to do? And what are you going to do? Right. Or, we're at the hospital and, like, where are you going to be? And a lot of times he'll say, like, well, I'm going to be over here in the corner in the chair. And I'm like, no, sir, you're going to be up front. You're going to be right here. We're going to do this. You're going to do that. And, like, don't worry. I don't expect you to remember everything, because I will be there, right, to back you up. But the connection that you two have that created this child is so helpful in this birthing process, right? So I need you up front. I need you to be here, and I need you to encourage her, and be her support. And, we're going to get through this together. And so always from the beginning, making sure that they feel included, that they understand that they are a very, very important part of this whole process. And so that way, we get fathers who then open up about like wanting to know more and wanting to understand more, but not really feeling like it was about them, right? And so, sometimes I do have a session where it's just the dad, because we need to talk about like what's going on with you so that you can show up better for this family unit.
Michelle, thank you so much just for sharing that. It's so interesting. One of the things I do as far as bringing in the partner is an exercise that we do while the person's pregnant. I'll have the partner come around from back and then lift the belly. And I do it for two reasons. First of all, it offers so much relief to the pregnant person, but it gives the partner a better idea of the weight of it, to be able to understand the heaviness and the issues with the person's body and the issues with their emotions. It just makes it more concrete. Often with pregnancy, as women, we know because we got these things going on, but the partner may not necessarily really understand the physiological and emotional things that come with being pregnant. So by going through and doing physical things, having that partner lay hands and caress and lift bellies and massage backs and massage shoulders helps them to see that their role in the labor is so significant and that it is a powerful role, because often partners feel overlooked. And for us, it's so important for us to be able to provide a support that supports that family system and not just an individual.
Beautiful. Thank you both. Oh, Nakomi, did you want to add to that as well? Please do.
Yeah, everything that Michelle and Felicia said, and just a little bit more. Sometimes, fathers, they want to know how they can be present. They want to know, sometimes it's not always necessarily talking, but through touch. Touch can make such a significant thing to the mom when she is birthing, because it just lets them know, hey, I'm here for you. Hey, I may not know what to say, but I'm here, and just even if it's just eye contact, and you're looking at that mom and telling her, I love you, we're getting through this together. That is such a big thing, for moms, letting them know that they don't have to do this alone. So I think that's also everything that everyone said is beautiful, and just to welcome the dads as well.
Just building yeah, I wanted to build on what Nakomi's saying, which is from some of my teachers and mentors, which is the facts, which is what gets the baby in, gets the baby out. So your tender loving care and touch and kindness and presence and love releases hormones at birth that are necessary for the uterus to contract and to bring the baby down through the pelvis. And the baby's head puts pressure on the cervix, which then spaces and dilates and descends and eventually is born into your arms. So we need that oxytocin and relaxin and all the beautiful birth hormones. And so when you're kissing and cuddling and touching and gazing and your presence, your loving presence, and just even quiet and calm helps create the biochemical mechanisms that yield a really positive birth experience. And we want our families to have a beautiful, loving, just really centering their needs and the beautiful experience that birth can be when that happens. So what gets the baby in, gets the baby out. And even sometimes when we think about, not everybody has or is fortunate enough to have a partner or has that kind of relationship. We have very various kinds of relationships or situations that present itself within the family system. And so a doula also can really come in and support and allow that loving glue to give the birthing person what they need to feel safe and loved and to have that beautiful birth.
Beautiful. Thank you. I had to write that down. What gets the baby in is what gets the baby out. I love that wisdom. And also what I heard, it was the thread in all of your shares, was giving the partner, and not even really giving, but letting the partner and or father know that they have permission. they have permission to be present. They have permission to be a part of this experience. So that's very powerful, very powerful. So we're nearing the end. So I have one more question, and this is for Michelle and Kefri. What advice, tools, resources would you give to Black families as they strive for autonomy and joy during the pregnancy, birth, and postpartum time?
You know, it's so crazy that, I'm here, going through, like, I think about like things that I struggled with in the past. I think about when I had my children, and a lot of the work I do is based off of the support that I needed, right? I think about when I was in that place and what would have made things a lot better for me. And so that's how I try to show up for folks. And so for Beauty for Ashes Maternal Wellness, we provide doula services to folks who are in need. A lot of the clients who come to us are, in high need and crisis, not necessarily a high risk pregnancy, but, some of those social determinants for health that I mentioned, like Felicia mentioned, having clients that are homeless. Sometimes, there's food insecurity, just different things going on with clients who happen to also be pregnant. And so it's very important to me to be able to offer really comprehensive support. So, yes, we're going to support you through this pregnancy, but wraparound support, because we want you to thrive, right? We don't just want your family to survive, we want you guys to thrive. And so, making sure that you find support that is aligned with you, because we all show up differently. Like, we've been working together for years, right? And we know and love each other, but we know sometimes, like, I can get a client and I know that that is a perfect client for Nakomi, not necessarily for me. They will be much better with Nakomi. And so it's really important to make sure that you do your due diligence, right? To figure out what support looks like for you, and then to try to get connected to that support. And then also just remembering, as community doulas, when you get one of us, you get the community, you get us, right? So we tap in with each other all the time. And so it's very important also, to just really use your voice and say what you need, because we're very intuitive. We can pick up on some things, but sometimes we just need you to say. Don't be afraid to ask for what you need. Don't be afraid to advocate for yourself in any situation. And your doula will be there to support you in ways that you probably didn't imagine. Most families that I work with, I learned something, and 20 plus years of doing this, I'm still learning from the people that I'm connected to. And so we all have something to teach each other. We all have something to learn from each other. But it's just very important to communicate.
And Kefri?
Yes, I know that we have some resources that will be able to come up on the screen with some of the
Mhm.
websites that we want to make sure families had access to. And also letting all families know who are Medi-Cal beneficiaries that you can contact your plan for referral for a doula. This is a new benefit. It just launched January 1st, 2023. So as doulas are being, developed and signing on to be able to be approved providers for Medi-Cal, you may still need to contact these other community-based organizations for doulas. So you can reach out to us for all types of amazing support through our website, www.frontlinedoulas.com/community info. Also, you can book a free telehealth call with the Frontline Doula Hotline. Go to frontlinedoulahotline.com. It's also on our main website. You can contact the AIM program, the African American Infant and Maternal Mortality Initiative, their doula program at blackinfantsandfamilies.org. Beauty for Ashes Maternal Wellness is beautyforashesmaternalwellness.com. Kindred Space LA is also a birthing center that has BIPOC doulas that are on volunteer and also available to be hired at kindredspacela.com. And Join Birthing has volunteer doulas at joyfulbirthingfoundation.org. If you're in the Inland Empire, Riverside, or San Bernardino counties, you can go to Sankofa Birth Workers Collectives at the Inland Empire, or the Doula Access Program in the Riverside Community Health Foundation. Long Beach Birth Workers of Color is there for you at birthworkersofcolor.com. And in the South Bay, we've got the very established SBCC Thrive LA, and also Black Infant Health. So there's also, on the next slide, there's really amazing national Black doula directories, such as the Black Birth Workers Rock and the System Midwife Directory. And if you're having needs in the postpartum period for your mental health, you can go to Postpartum Support International, in addition to calling the National Maternal Mental Health Hotline. Black Infant Health is local to your community, and they're ready and able to help you and support you in your perinatal time, as well as finding out more about birth advocacy through the National Association to Advance Black Birth and Black Mamas Matter Alliance. So all those are going to be available on our website. If you do go to frontlinedoulas.com and to community resources, community info, it's there for you. And so you can also join our Instagram. We're going to put that slide up, which is Frontline Doulas on Instagram and also on Facebook. We share a lot of resources through our Instagram all the time. Yeah, so there you go. Please join us. And also Beauty for Ashes Maternal Wellness on Instagram, and these beautiful doulas that are here on this call. So we really wanted to be able to, we have a couple minutes. And don't forget, the revolution is in the womb. I'm sorry, I had to really like give a moment for that, because it's there for a reason, that the revolution starts even before birth. It starts inside of the womb of the birther and the womb of the world. And so that revolution really is about restoring justice to our homes, to our communities, and to safe birthing practices. So it starts there, and it starts with everybody who's listening on this call that can support their local doulas and even their local birthing families and getting the care that they deserve, and really listening to what they need during their perinatal time and allowing them to make their autonomous choices so they can birth into joy. I think we wanted to open up the chat, if possible, to answer any questions, and we can see if there's any comments. Deanna, do you see? I see that Joy 4828 has been here and present. Thank you so much for your beautiful presence here today. We're hoping that the services and resources that we've shared will be able to help you connect doulas to families and families to doulas.
Yes.
Deanna, was there some questions that we also had that we wanted to present here?
Hi.
So I believe Madeline is there.
I'm back to do that for you.
Thank you.
But thank you so much to all of you for this important, relevant, vital, life-saving, uplift information share. I've really enjoyed listening to all of the things that that you are sharing, and your presence, and just your passion for this work. It is really important, and we're really happy to continue to support getting this information out to community members. And we have a couple of questions in case there weren't any in the chat. That we have lots of compliments, but let's see. I have a couple of questions. So I've heard that doula services can be expensive. So how much do doula services typically cost?
I'll jump in. So, it really just depends. Like we've seen doulas charge as little as $300 to upwards of, $2,000, $3,000, right? And so there's a lot of things that come into play. However, I don't want people to think that a doula who charges $500 is less effective than a doula that charges $2,000 or vice versa, right? So a lot of times, even for myself, it really just depends on the client's budget. And if we connect, then I'm able, as an independent doula, to say, I will meet you where your budget is. And so, I talk about finances being a barrier of support for some people. And it really shouldn't be, because, again, you can say, you need to ask before you just assume that you can't afford doula services. Ask around, right? And so some of the programs that Carefree mentioned also provide doula services for free. The doulas are compensated by the organization for which they are contracted, but the service is free to the families. And so more than likely you qualify for a free program. And then the Medi-Cal benefit, that's not only for Black women, that's for everyone. That's for Medi-Cal beneficiaries across the board. So you may be able to get a doula that way. Also, if you have private insurance, your insurance may reimburse for a portion of or all of your doula support. And so there's a way to go about that. And, so there's ways to get doula services. And for people who are paying out of pocket, we offer payment plans. So it's accessible as far as the finances go.
So much. Was there anyone else that wanted to add to that?
Well, yeah, what I wanted to add, and I think everybody here may align with this, is we want to anoint a doula in every family. You can be your sister's doula, your cousin, your mama, your grandmother. You can be a doula just by simply being present and being that support person. Yes, there are doula trainings that you can take. Yes, there are certifications and higher level of experience and education and training. But really, a doula is an emotional and social and physical support person. And the research that's been done on it is just that simple presence alone can lower interventions and lower the need for pain medications and can increase healthy birth outcomes. So just remember that we have the power to birth. We have the power to give community care inside of ourselves and in our own kinship ties, in our own family circles. It doesn't necessarily have to be I'm a professional doula. It can be one that has received that calling and is there to support you. My sister and my best friend Ada were my doulas. I didn't have money. I was birthing on Medi-Cal, and here I am today, 20 years later. You never believe it, right? And so claim your doula care within your own family kinship ties. Remember that, because your family is really the gold.
And I can say that my work as a doula started off working with family and friends. That was the huge basis of what I provided. So there's ways around the financial piece of it. Don't let that dissuade you, because it's just possibility with all the resources that are out there. So
Thank you. And previous to this panel, I know that we just touched on the fact that Kindred Space does provide free or low-cost education and training for people who are interested in exploring becoming a doula. So if you have that family member who is interested in just feeling a little more comfortable in that support role, that might be something to look into. Did anyone else have anything to add before we move to the next question? Wonderful, thank you. And as a person who's not given birth, sometimes I'm curious about this as well. What is a birth plan? Like, why do you need one?
Well, the birth plan
is obvious, but I want to know more.
A birth plan, it can also be called birth preferences or birth goals. It's really a communication tool that the birthing family has to communicate to their care providers and their family members. So when you're building your birthing plan or your birth goals or preferences, this is typically a way that you communicate what your desires are with regards to medical treatments or choices. So that way, it's not catching you by surprise during the time of giving birth, where you're really in the birthing mind, the primal mind. You're not in the frontal lobe or the executive mind where you're making decisions. It's a very heightened emotional state giving birth. So a birth plan is a way to communicate your choices around interventions or positions or what you like to eat or, what your religious preferences are or observances are. And so you want to start that conversation before your actual birthing time. And so doulas can help you create your birth plan or birth goals. And you don't want to be rigid with it. These are just things that help and give a framework for support on what your choices are and what your desires are as a family, right? And it can really change outcomes, because then they can't assume for you. You are for yourself, and uplifts your voice and begins the conversation with care providers. Honey, you don't want to be having these conversations when you're pushing a baby out your body. Right? That's not the time to be like, and I didn't want an episiotomy. It's a little bit too late for that. So, for example, Nakomi had brought up that there was a client that had experienced situations in her life that she did not want to have those who identify as male in her birthing room. That was extremely important for her safety. And so that conversation would have started via her birth plan and via conversations with the provider way before the birthing time was there. And so those birth preferences help you to figure out what works for you, and also how to communicate to the care providers, knowing that as adults, we know that there's fluidity in all the choices that we have,
Mhm.
and that things may change, but indeed we want to be aligned with what the original plan was and what your original, beliefs and choices are.
Thank you. I really appreciate understanding that it's a communication tool, just like any kind of project management tool that you might be involved with in any work environment. Um, it's your plan.
Yeah, if somebody's at your perineum, don't you want to plan?
Yeah, that sounds right. Even though it's not something I've experienced, but it seems like yes, you want to plan for that. And as a communication tool, it really makes it really clear what that birth plan is for. So thank you. And
I
here's
wanted
a.
to
Did
piggyback
you want to
with
add to that?
I also wanted to say the birth plan not only is for the mother, but it's also for when the baby is born. You want to know, you want to be able to say what you want for your baby or what you don't want for your baby. That's really important to understand, or for the doctors to understand the next step
Mm-hmm.
once the baby is there.
Thank you so much for adding that. And our last question, I've heard that you cannot eat during labor. Is this true? And what are your choices?
Okay, that is right now such a heavy debate.
Mm,
Imagine someone who is pregnant and in the hospital, and maybe their labor takes up to 48 to 72 hours, and they
mm,
haven't eaten during that entire time.
mm,
What tends to happen, they're given broth or jello or juice, but for the most part, not being able to eat. So
mm,
for me, it's as if every pregnant woman is being treated as if she's pre-op for surgery.
mm,
So that it's designed to, in case the person has to have a C-section, they want to asphyxiate. But I think
mm,
it's a disservice to a pregnant person to be in a setting where they're not getting adequate nutrition.
mm. Yeah.
Yeah, like having a pregnant person in labor for however long they're in labor, right? They're not getting nutrition, they're not getting calories. That's like asking you or I to go on like a 2 day fast and then run a marathon. Like,
Mm,
we're not going to make it. You need to have adequate nutrition. You need the energy, you need those calories.
mm-hmm,
And so that's one of the things that, like, Felicia, that's like a really touchy subject for us because we, just anatomy and physiology, it is what it is, right? We know how the body works and we know what the body needs. However, the healthcare system, which, me as a surgical tech, I always got those moms who had not eaten for however long. And now we're in here for a cesarean. And so I do understand why that policy is in place at a lot of healthcare centers.
mm-hmm,
However, like Felicia said, we're not prepping everyone for surgery.
mm-hmm,
And so a lot of the things that they do is just because of, like, the what ifs, the, oh, we need to, not have a situation just in case.
mm-hmm.
But if this mom is laboring, everything is going beautifully. Small bites are okay, and it really will help with this labor.
And in addition, it's evidence-based, meaning that it's been proven by the research to support positive birth outcomes. And unfortunately, hospitals and the medical industrial complex have not updated their policies to fit within a human rights framework. So it's within your human right to eat. It's a free
Mm-hmm.
country. You can eat what you like, even at your birth. And so while there is a very small, I mean, we're talking about very, very small risk of asphyxiation in the event that you need an emergency cesarean, even that you can make the decision whether to eat or to hydrate on whatever you like. It's
Mm-hmm.
your choice to do that while you're giving birth. And so that is also recommended by ACOG. That is the current evidence, and also by WHO, the World Health Organization. And this is what we're talking about with doula care, is that we return the choices and human rights to the center of this conversation. This is what
Mm-hmm.
justice is to not stop people from eating peaches or having tea if they want it, is that whatever they need to give themselves
Mm-hmm.
energy and to feel supported is what they deserve. And it's up to the hospitals to update their systems, but it's up to the families to know what their rights are and what the evidence is, and to really trust themselves and to work in collaboration with their care providers. That's another thing you have on your birth plan. I plan on eating and drinking during labor. Do you have a problem with that? And the doctors go, no, absolutely no problem at all. So it's a conversation, whereas if you
Yeah.
just go to the hospital without these conversations previously, you're going to go through all the different policies that take place. And we're not having an adversarial role here, we're having a collaborative role, right? So that way there's a kind and gentle birth, which means you can eat and you can drink if you'd like to. And it's proven that especially even hydrating, not getting an IV, can yield the same results, if not even a more positive birth outcome than just regular IV fluids alone.
That's so important to know. Thank you so much. And we are a little over time, so I'm going to bring us into a conclusion. Once again, I really appreciate all of the time and prep that all of you input into this program today. It's so important. This program will be on our YouTube. There are questions about social media. All of that is listed at the end of the presentation on the last slide. So questions about that. And you can mention Frontline Doulas. Your website is, you want to say that out loud?
Yes, it's frontlinedoulas.com and
Okay.
frontlinedoulahotline.com.
Wonderful.
So,
And we can't appreciate your services enough. So thank you again. And we hope to see you back here at a future presentation. Thank you to our audience for attending today. Please share this presentation out widely to your community members. The information that's shared here today is so important to uplift. Thank you so much and have a wonderful day.
Thank you.
Thank you.